Welcome everyone to today's office hours. So in this episode, we're going to discuss Smart PT re-verification lessons from Mary Freebed. We're excited to have all of you with us as we dig into some of the real world challenges that come with eligibility verification and prior authorization in physical therapy, particularly, especially during re-verification season, which will be here before you know it, believe it or not. So I'm joined today by Daniel Heemstra from Mary Freebed. It's in the title. So Dan, thank you for being here with us. How are you doing? And tell us a little bit about yourself and who is Mary Freebed?
Well, thank you very much. I'm glad to be here and glad to be a part of this. My name is Dan Heemstra. I am with an organization called Mary Freebed Rehabilitation Hospital. It's an organization that's been around for almost 150 years. The organization got started back in the late 1800s, basically, because the women in the area were realizing there were no hospital beds for those who couldn't afford it. And they wanted to provide for a bed for those who could not afford to go to the hospital. Of course, that was before health insurance was here. So they raised money by saying the most common name for women at that time was Mary. And if you were a Mary or you knew of a Mary, would you donate 10 cents so that we could buy a hospital bed for those who can't afford it? And that's where the name Mary Freebed came from. And ever since then, we have been helping those who couldn't always afford healthcare. In the middle of the last century, 1900s, we started focusing on rehabilitation. And so that's been our focus. We are a rehabilitation hospital, both inpatient and outpatient. So it's a great organization to be with because we see a lot of great stories of people who come in after a car accident, after a stroke, after childbirth defects that prevent them from walking, and see recovery that takes place. And so we have a lot of great stories that we're very proud of.
Wow.
So
Yeah, that's I like to hear those origin stories because it's always, out of necessity and also out of charity,
yeah,
out of the need to help those who are suffering, rather than for profit. So those
yeah,
are always the best ones, in my opinion. And that's great. So, yeah, and obviously, being a rehabilitation hospital, we're going to talk through Mary Freebed's journey a little more, but also we're
yeah,
going to talk about Dan's personal experience with re-verification and prior authorization and what that looked like for his team. Obviously, they partnered with Infinix, but what that looked like for his team before the partnership. Also, what methods that they tried to manage that process. What were some of the things that they did, then how things have changed since. How the outcomes and what outcomes they have actually seen since then. So along the way, I'll share a little bit about how intelligent automation and AI agents run in the background to simplify that process and reduce staff burden. So we'll explain that nuance and that relationship as well as we go through the story. So before we dive in, I always like to remind everyone that we will have a Q&A at the end. So if you have any questions, please drop your questions in the Q&A box below. Also welcome comments. If you have any comments you want to share, any insights, please share those as well. We like to make this conversational even with our audience. Even though we can't hear your voice, we can see your questions and comments as well. So Dan, you ready to jump in?
sure. Let's go for it.
All right, all right. So you told us a little bit about Freebed, and how it got started, but can you start by sharing a little bit about your role and your journey at Mary Freebed? What brought you into the re-verification and prior authorization process day to day?
Yeah. So probably for many people who end up in hospital revenue cycle, it wasn't necessarily the career that you intended to go into. You kind of end up in this position, and that's what happened for me. It was post COVID pandemic. I had moved up to Grand Rapids, Michigan, and I had aligned myself with a temp agency, and I ended up getting hired into the utilization review. which does all of our eligibility and benefit verifications as well as authorizations for just the outpatient portion of what we do here. And working in that for a few months, eventually became the team lead for the UR team. And since then, just recently, earlier this year, became the revenue cycle manager for our hospital billing end of things. So still overseeing the utilization review, but I've expanded my role to do more with the billing and denial management and things like that.
Yep.
So yeah, we um, kind of given our journey of where we are, our outpatient therapy has really been growing a lot. And since COVID, it really grew exponentially. And we had always done it internally. We'd always had our own people do the authorizations and verifications. For years, our access team would schedule the patients and then get the benefits and upload all that information. Just after COVID, we split it off so that we had one team who did the scheduling end, the front access end, and then one team that did with the verifications and authorizations. And that's what the switch had worked with, and we found it to be very helpful. That UR team could then work with our billers to understand why we're getting denials, but then also work with the front end to know, oh, we need to get authorizations for these things. Our outpatient has both professional billing and hospital billing. So we have therapies. We include neuro therapy, both for peds and adults, and we have musculoskeletal therapy as well as a pain program. And then on the professional side of it, we also have physiatrists and psychologists. So all of this, we had this team getting the authorizations, getting the benefits and the eligibility, updating our electronic medical records, and then as necessary, getting the authorizations for. We had done that for a number of years, and our outpatient program really started to kick off post-pandemic. And we had always been able to staff the team. But what they were finding is that they were hiring more people, but for every about 4 people we would hire, only one of them would be the one who would stick around and would either be a good match for us as a team or would even find it interesting enough to want to stay and to learn. So we were having a hard time finding people to do the work and to stick with it. And we got to a point where our outpatient volumes were continuing to grow. Not only did we have a hospital based here, we also had many offsites that were growing. And we had taken on more and more of the authorizations and verifications for the offsites as well. And so we were at a point where we cannot hire enough people, get them trained enough, and get them to stay long enough for us to keep up with our increasing volume. And so the leadership at the time said, okay, let's look at some outside options that we may have. And actually, from what I understand, our professional billing team had gotten Infinex's name. And from that, they had looked into utilizing Infinex at the time. And then for whatever reason, chose to go a different direction. We changed our electronic medical record. That was part of it. But he gave the name to the hospital billing and professional billing managers of Infinex. And so they reached out and said, well, what can you offer us? And they contacted a few other companies as well. And I just asked today, why did you guys eventually choose Infinex as opposed to some of the other ones? And they said, well, the biggest thing is that Infinex offered us that we could take them on by what we wanted. We didn't have to take the whole package. It wasn't all or nothing. Right. And they really liked that option to say, well, let's start with this. We'll start small, and then we can add on more and more options if we find a good fit. And that was a great option for us. So I think about February, March of last year, my team said, Infinex is who we're going to go with. And we had uh, started the process of working with the Infinex team and our legal team to sign the contract. We got that contract. We were hoping to get it signed by July. It wasn't until later in November that we finally got it signed. That took a lot longer than anybody ever expected. And that had a lot to do with because Infinex was really our first third party uh, corporation that we were using. And we didn't know all the ins and outs. And I think there was a lot of learning that
Mm.
our upper level management and our legal team had to figure out um, of how to get Infinex on board and to sign the agreement and make sure that everything was set. So it took longer than we thought it would, but we were able to get them signed in and started the beginning of this year. And
Nice.
that has been a long journey, but we're finding it to be very helpful for us.
Right. That's amazing. And yeah, so that is one thing that, resonates with, when I came to Infinix and immediately picked up on was, how they're agile and
Yeah,
don't they come in where and meet you where you are. What
yeah,
is the problem you have right now today? And then there's expansion opportunities, based on if that need grows, if there's other aspects. So it sounds like the biggest challenge that you had was staffing. It's a
yeah.
good thing that you were growing. Growth is
Right,
always good, right?
right.
And but then there's challenges with that staffing and the staffing that was brought into the fold to help with that. Can you just elaborate on kind of what that looked like, what that felt like? What were you doing presently before the contract was signed and the Phoenix came on, and what was that onboarding process like? And uh, are you seeing the outcomes that you want as a
Yeah.
result?
So we had split our team into three basic areas. We had our neuro uh, and pediatric team for our main site, and we had our muscular skeletal and professional team or pod for the main site, and then we had a third one for all the off-site locations. And each of those three pods had about four team members to them, and they had a financial class that they had to take care of. And so it was basically an insurance. For us, Priority Health is a local insurance that is one of our biggest companies that we see. Blue Cross Blue Shield, of course, is one of the biggest ones.
Mhm.
Medicare, Medicaid is also probably the most we see. So we'd split it into these different, each pod had financial class experts that were there. And we found that to be very helpful because you learn the portals that each of those insurances use. You learn the nuances of what they cover, what they don't cover, how you get the authorizations for that insurance. And that worked really well for us. But we would find that, oh, we had somebody in covering this particular financial class, the commercial insurances, who leaves. And now we have to bring somebody else on, and everybody else also needs to learn how to cover the commercials while we're vacant and looking for it. And so we constantly were having to retrain everyone all the time whenever we had a vacancy. So what was helpful is Infinex was going to come in, and there's a lot of repetitive, similar kinds of things that you do just with verifications.
Mhm.
And for a lot of it, it's not takes a lot of brain power. It doesn't take a lot of time. It's just busy work
Mm.
is what it is. You
Right.
got to go to the Availity website, find out with Blue Cross Blue Shield what the benefits are, and then they may or they may not tell you how many visits have been used. So then you may or may not have to call. And so that just is very time consuming. And we were probably averaging about 15 minutes per um, verification that we had to do. And for the neuro, it took a little bit longer than for the muscular skeletal. but we could not get that number down. It was around 12 to 15 minutes. Well, with that, I knew as our volumes increased, I needed more staffing, and we just were running into not being able to get more staffing. So when we brought Infinex on, the timing worked so that we started the beginning of the year with Infinex. And as you said, the beginning of the year, when most insurance companies have their renewal, we have a huge re-verification process we have to go through, and confirming the benefits are the same, the coverage is still there. And so we started with Infinex saying, okay, this one particular location, actually it was two locations, we want you to do all of our re-verifications. We figured out how to do that by uploading it daily. I would send it a CSV file daily to our Infinex contact. They would input it into the Infinex portal, and their team members then would work it. And then my team members would go in and say, okay, for this one, copy the benefits as Infinex has given to us, and move on to the next one. And we went down from about 12 to 15 minutes per verification. We were able to get closer to 5 to 7 minutes with that process
Wow.
that we found with Infinex. It took a while to get to that reduced rate, and that probably a huge part was because my team members were reluctant.
Right.
They saw Infinex not as somebody who can assist us. They saw Infinex as they're here to take our job.
Yeah. It was the threat.
And so that was a huge part of what we had to get over, is to say, no, these are people here. This is something that will assist you in being able to do more work and to do it more efficiently. And
Yeah.
I had to at one point even say, okay, you cannot initiate your own verification. You cannot initiate your own authorization. You have to go through Infinex. Just force them to do that. There was a lot of grumbling and a lot of complaining about it, but we got to the point where they were like, you know what? It actually is easier when we go through them.
Right. Right. Right.
We found
Exactly.
that eventually we won everyone over.
Yeah, and we find that, across the board, and it's not just, in Phoenix, it's also, any staffing. That's been kind of a long, um, stigma, if you will, anytime there's service oriented, but also with AI and automation, it's the same
Yeah,
thing. You can, plug and play. And some of the ways in which I know our efficiencies are on the back end, because when you send it to Infinix, you necessarily don't see how the sausage is made, so to speak, to use that
right, right.
analogy.
Yes.
So, but we have a lot of things going on, and we like to call it orchestration. And we're orchestrating where the workload goes.
Yeah,
And what's being deployed is AI agents, or agentic AI, if you will. So where we're actually having those direct connections to the portals, the agents actually determining, which portal's the best. We even have the use of RPAs, because not all payers have portals. I think you mentioned a few that probably
right,
don't have an API that you can actually do a direct connect with. So you got
right.
to use an RPA, but we all know that RPAs can break. And for those, it's
Yes.
robotic process automation. I got to always kind of spell out my acronyms, make
Yeah,
sure the
no,
audience understands. But so when that breaks, we've actually developed an AI agent that can go and repair that RPA when it
right,
happens, right? So it's like, instead of a human, yeah, it's calling IT, oh, it's broke again. Okay, yeah, let me go in there. You got to write up a ticket and everything. No, this thing actually goes in and repairs it automatically. And then we're actually making, and if there's prior auths needed, we have an agent that's doing a determination of whether or not an auth is required, and then initiates that auth automatically, and also then goes to follow up. And any
yeah,
exceptions, this is where the orchestration is such a beautiful thing. Humans are still in the loop. If there's any exceptions or hard cases, like you said, you had some neuros, that and musculoskeletal, maybe some things that were a little more complicated. Yeah, that can actually go to a human exception. It could be that someone's on our team. It could be someone on your team. So it's really kind of where in that background, to you, you're kind of seeing, hey, the work's easier. Oh, it's all easier. but there is some action going on in the background that's deploying intelligent automation, it's deploying AI agents, and also including humans. So we call it tech-enabled services,
Okay.
where it's AI plus humans or humans plus AI. It's an augmentation of your staff
Yeah.
along the way. So I just wanted to kind of resonate that to what's going on behind the scenes of what you just described.
Yeah. And what I've seen with my team is they realize that they are limited in how much they can do. If they have to make a phone call, that's probably
Mhm.
closer to 30 minutes it's going to take.
Right.
But with Infinex, if Infinex is working on it, they can go to other things and work on other things. And then when Infinex has given us the information, now we can go on and quickly move on. You're not stuck waiting on a phone call for this horrendous hold music to finally be answered by a human person.
Right, exactly, exactly. It does make, life easier. And,
Yeah,
that's kind of where, again, with this re-verification season, many people are overwhelmed. They're still working out of spreadsheets. They're still trying to coordinate. Many of them have this tactic and practice of, well, we're going to schedule all Medicare patients the first 2 weeks of January, because then you're at the mercy of the payer to update their policies.
yes,
And many of them are very slow. So you have to know which ones are being updated. You have to pay attention to when they're updated.
yep,
You have to then coordinate re-verifying those patients, and you try and make it transparent to the patient, right?
right.
Sometimes I was just on a call earlier this morning with another prospect, and they were like, he was describing how the patient was having to call the insurance
Yeah,
their
yeah,
behalf to
yeah,
light a fire, so to speak, right? And
yep,
it's like that just shouldn't be that way. The patient shouldn't be inconvenienced. They're bad enough that they're in pain, need to come to therapy, So
yeah.
um, it's very
And
vital.
we
And
were
yeah, go ahead.
we were being hounded by patients, but also by the therapists and the schedulers to say, "Can you please re-verify this so that we can get this scheduled?" And we're like, "We only have so much time that we can do this." Every January and February, I would have the whole team. What they love working for me is that we're very flexible, and many of them are able to work remotely from home.
Hmm.
Um, and at the beginning of the year, we were like, I just need to make sure that everybody's doing it. You have to come to the office. I made everybody come in. I made them work some overtime. And they, uh, they did it the first year with much grumbling, and they hated it. Um, but they also understood until they were able to get that re-verification process completed, they were going to continually be hounded by therapists and schedulers and
Hmm.
patients because they want the therapy
That's right.
and they want to know what their copay is, or they want to know how much it's going to cost them.
Yeah, or they don't want to, show up, and then all of a sudden, hey, we have to reschedule because your authorization didn't come through,
Yes. Yeah.
or your wait, I was authorized already. I've been authorized. Well, it's
Right.
January the 6th,
And
and we didn't
a
get the
new plan
information.
year.
Right, right. So yeah, and traditionally people threw just more bodies at the problem, right?
Yeah. That's
And
all we did.
yeah, yeah, yeah. And I know that's where Infinix can augment your staff, but again, it goes back to that augmentation is further augmented by agentic AI, and I just can't stress enough how easier it's made us, and that efficiency is passed down, to customers like Mary Free Bed.
Right.
And
Right.
they're taking advantage of that technology, even though they're not using that technology directly. That's what I'm
Yeah.
trying. Right, right. So, and with that said, on that vein, I would like to look ahead right now.
Okay.
Um, and I always ask guests this question. Not, I don't ask every guest this question, but the majority of them. But if you could change one thing to make re-verification and prior authorization easier overall, whether that's technology, regulations, uh, payer processes probably come to mind. What would it be? What would be something that like if you were the czar of re-verification, what would you do?
Well, usually it's, can you please let us know sooner if the plan year is going to be the same? Because so often I can't figure out the new plan year's benefits until January 2, when, we come back into the office. If we could start knowing this back in November and December, that would be really helpful, so that we don't have to touch every single one starting January 2. We could start working on the ones who are already scheduled, who are going into the new calendar year, and make sure they're done first. We have a lot of patients who will, of course, be in therapy. We want to make sure that the benefits are verified again. Last year we had a Medicare HMO who changed their whole fee schedule, their whole copay schedule. So all the copays had to be changed on every single patient. So we had to manually check each one. And of course, the HMO, the Medicare HMO had a different fee schedule depending on the plan that they had. So some of them had a $40 copay, some of them had a $25 copay, some had a $35 copay. You had to check each and every single one. Well, if we could start that process much earlier, that would have been really helpful. But that's if we were manually having to do it. If we could have this done, like you said, with AI, then we can get to it when it's available by the insurance plans,
Right.
and handle it. The biggest struggle that we had this year with our verifications, and starting with Infinex, we were starting to learn the process. So we had to learn the process, the Infinex process, and learn how to incorporate that into our electronic medical record process. We were not fully integrated yet, so we were uploading a CSV file, and then we had to go onto the portal, the Infinex portal, and get the information. It would have been a whole lot easier if we could have been integrated with both of our electronic system and Infinex right away. We're working on that right now. It's taking a little bit longer, partly because we don't have our own license. So we are on a community license with another system. So we're having to go work through another system who have their own concerns and processes and things like that. But once we get it integrated, then we can directly have the Infinex be sent the information, and as it's uploaded, as it's updated, and send it directly back to us. We don't have to somebody doesn't have to copy and paste every single one.
Right.
So I'm really looking forward to that process getting worked out, and that should be in place for the new year for us.
Yeah, that's going to be really nice. You're going to see a significant drop at that point,
Yeah,
and
yeah.
the time it takes to get those verifications done. Yeah, that's awesome. Well, that's all the questions that I have at the moment. We're going to go to audience questions now, and I just see a couple in here already. I just want to encourage, as we're in this phase, to drop a in the Q&A. Any questions? Again, any comments? But here's a question, Dan, and either one of us can answer. But we've struggled with keeping up when payers suddenly change their re-verification requirements mid-treatment. How does a solution like Infinix help teams stay current without constantly retraining staff?
Well, let me explain a situation we had last year. UHC changed their requirements, UHC Medicare, requiring for therapy that you had to have prior authorization for every single physical occupational speech therapy. They did that September 1st of last year. They had sent us notification, I believe, like in July or early August. UHC was not fully prepared. Their staff did not understand. We did not have all the information of where we were supposed to go to get it, how we could get it online. Do we have to fill out a form? So there was all these questions, and it took us at least 4 months to figure out how to get that process done. We had to do that manually because we didn't have Infinex. Now, Infinex is responsible to make sure that they understand the processes, and that they would understand if authorization is now needed, a prior authorization, to put that in the notes so that we can note it for our providers to say, if for treatment, we're going to need to have prior authorization. And with one click, we can then start and uploading one set of notes, we can start the authorization process. So that is so confusing. They make a change. They don't necessarily have it all worked out with all systems. Not everybody's totally on board with it. So it is a real pain, I will admit.
Yeah. Yeah. Because I also know from experience, anytime regulations are updated, particularly with Medicare intermediaries, like UHC as a
Yeah,
prime example, they don't really tell everyone. They say, here's what we're going to do. And then
yeah,
there's no plan on internally how they're going to handle it.
yeah.
And so it's just becomes a hot mess for everyone looking at each other, and no one has a clue. Even the people that probably set the policy
Yeah.
didn't even think ahead. It's always the people who make regulations changes never think in the execution of those regulations. I just,
And I had, three team members who were instant messaging back and forth with each other saying, okay, this is what I learned today. Okay, this is what I learned today. Okay, this is what we need to do now. And it was constantly changing because nobody knew.
wow, that's awesome. Well, we do have one more question, and I think we're
Okay.
going to stretch our time here with one more question. In physical therapy, patient care schedules can be unpredictable. How do you balance the timing of re-verifications with making sure patients don't face interruptions in treatment?
Yeah. Um, with physical therapy, occupational therapy, all of them, um, the one thing you'll learn is that unlike most other types of medical, it's a kind of a finite thing. We know it's going to be a one and done, or it's going to be three different things. You have a pre-op, you've got the op, you got a post-op, whatever. But with therapy, they write a plan of care. The plan of care says, I expect this to be 12 visits. And then because of who knows what, the plan of care needs another 12 visits. And you get some workers' comp where it's 70 visits. And so it's not a one and done. And that is really hard to predict that because you're constantly having to check how the patient is progressing and what the therapist thinks is best for the patient. And then working with the insurance companies to say, well, this is what we say, this is what the notes are saying. And they're saying, yeah, we don't want to pay for that, or we want to limit it that. So it is very unpredictable. And the way we triage it, of course, is by currently, and I don't know if this is the best way, I would be welcome to hear other ways to do it, is by data service. Um, and we're just going to make sure that today's visits are covered, tomorrow's visits are covered up to a week ahead, and then working from there. Um,
Right.
our electronic medical record is set up right now that if it's within 2 weeks of the authorization or if it's within 4 visits, we get notification. We then work to see if further auth is needed for that. Um, that's a hit and miss because sometimes patients make decisions that say, I'm going on vacation, I'm a snowbird, it's now winter, I'm stopping it, and I'll see you back next March. And that's not necessarily in the notes either.
Right. Right. For whatever reason, they've said, nope, not doing, or hey, I can't take it anymore.
Yeah,
You know,
yeah,
I'm done. So yeah, and then they come back later,
yeah.
so exactly, exactly. Well, that's it for the questions. I really don't see any more in the Q&A.
Okay.
So Dan, I just want to thank you again, for
Thank you,
joining us,
Stuart.
sharing your experience, telling your story. I always like to hear people's stories. It's always valuable to hear directly from leaders like yourself who are working through these challenges every day. So I really appreciate you opening up to us, and we'll hopefully have you back post re-verification time so we can hear how that went
I
for
would love
sure.
to.
Yeah, that'd be awesome. I want to thank you for everyone else who joined us for this office hours. We hope you found today's session helpful. And just think about your re-verification processes. If you need assistance, please call us now. It really is going to be here before you know it. And yes, we can take you on likely in December, but if you call us now, it would be much better. So just saying that. But with all that said, you can also visit our website for more information at www.infinix.com. And you can also contact us. You can actually contact me personally. I'd be glad to talk to you. Always like to hear everyone else's story as well. So with that, we'll see you with everyone on our next office hours. We hope everyone has a great day.